Hi, Stephanie Stanton here with Mahalo.com. We are talking about infertility and some of the choices when talking about infertility treatments. How do you know which treatment is best for you? Well, Dr. Jain is here to help us sort it all out.
We provide treatments based on the actual problem, the cause of infertility, the age of the woman, and really what she is prepared to do. You have to listen to your patient. It's best to go from simple treatments to more complex treatments. Simple could be as simple as advising a couple on when to have intercourse, when the fertile window exists. The next steps are typically using the tablet form of fertility medicine, something called clomiphene citrate, with artificial insemination. After that, we move into more advanced therapies, the use of injections of hormones to induce the growth of more eggs. We can either use artificial insemination with those eggs or move directly into in vitro fertilization, which is the most advanced technology we use. For those couples who need to look elsewhere for an egg or even sperm, then we move to what's called third-party reproduction, egg donation, sperm donation, and gestational surrogacy.
Now, when you talk about making the choice, you have artificial insemination versus IVF. What are the success rates, percentage-wise, of each of those choices, and how do I know which one of those is best?
Yeah, it's a really important question. The purpose of the simpler therapies is to bring the baseline pregnancy rate back to normal. And for most women under 35, that's 20% per month. In vitro fertilization and some of these third-party reproductive technologies have much higher rates of pregnancies and birth rates.
So given that fact then, why would a woman choose to go through all those other treatments when you can, let's say, jump right to IVF and have a much higher success rate?
Well, IVF requires a lot of time, injections of medicine, and it's very expensive. So it's a lot to go through and it's hard on patients. So a lot of patients would prefer to go simple and then move on to more complex. But what I think is really important is to know when to move on to more complex therapies.
How do you know? Obviously you'll help talk them through that process.
Yeah, we give it a chance. Usually we look at 3 months of trying something simple and reassess. But the discussion with the patients is critical in judging the right time to move forward.
Is there a limit to IVF cycles? I mean, what would you say would be the top limit where you said, okay, you've done this, X amount of times, I don't think it's going to work?
For the most part, IVF should work within 3 cycles. If it's not working, then there might be some significant problem afoot, and that might require some out-of-the-box thinking or maybe moving in a different direction.
But the good news in all of this is we have options, and a lot of them, thanks to modern technology.
Absolutely.
Well, thanks again, Dr. Jain. And if you would like more information about any of these topics about fertility, you can click on any of the links here to my left, or you can subscribe to Mahalo Parenting. I'm Stephanie Stanton. Thanks so much for watching.